Many times, red rashes appear suddenly on the skin, which are sometimes caused by psoriasis. Today, on the occasion of World Psoriasis Day, let us know about psoriasis from the famous dermatologist of our city, Bangalore and country, Dr. Deepti D'souza. Doctor, what is psoriasis?
Psoriasis is a common and chronic skin disease which sometimes also involves nails and joints. It affects about 3% of the world's population. The exact cause is not known. Multiple factors like genetics and environmental factors are known to play a role. It is an immune-mediated disease. Psoriasis is not contagious and cannot be transmitted by contact. Normally, the outer layer of skin is continuously replaced and it takes place in about 3 to 4 weeks. There is increased turnover of skin cells in psoriasis so that skin cells are formed and shed within 3 to 4 days. Although there is no cure for psoriasis, there are more effective treatments for psoriasis today than ever before. Treating psoriasis can improve symptoms as well as lower the risk of developing other health conditions such as psoriatic arthritis, heart disease, obesity, diabetes, and depression. All medications should be taken under supervision of a dermatologist.
Where psoriasis is most affected?
Psoriasis presents as reddish, well-demarcated, scaly, itchy, raised skin lesions, which are commonly seen on the outer aspects of the upper and lower limbs, palms, soles, and scalp. If psoriasis affects hands and feet, painful fissures or cracks can develop, and these can affect the use of hands and walking. Trauma-prone areas of the bodies like elbows and knees, lower back are commonly affected, and patients may have a single lesion or involvement of the whole body. Occasionally, patient may develop tiny pus-filled lesions. Psoriasis can appear anywhere on the body, even on the eyelids, ears, skin folds, and nails. And there are 5 types of psoriasis. People with psoriasis may also experience other health conditions.
What are the common trigger factors of psoriasis?
Infections like sore throat and HIV can trigger psoriasis. Certain medications like beta blockers for hypertension, anti-malarials, painkillers, or medication for psychiatric illnesses like lithium, and sudden withdrawal of systemic corticosteroids can aggravate psoriasis. Physical injury and mental stress can trigger psoriasis. Cold climates and winters commonly aggravate psoriasis, but some may have summer aggravation. Excessive alcohol intake and smoking also can aggravate psoriasis. Obesity and decreased physical activity are also known triggering factors.
What is psoriatic arthritis?
Psoriatic arthritis is a chronic inflammatory disease of joints which affects some people who have psoriasis. Most people develop psoriasis before psoriatic arthritis, but in some, joint problems begin before the skin patches appear, or it may be at the same time. Psoriatic arthritis affects about 30% of people with psoriasis. Joint pain, joint stiffness, and swelling are the main symptoms. Joints of hands are commonly involved. They can affect any joints including fingers, spine, and it can vary from mild to severe. Disease flares can alternate with periods of remission. It can start at any age. The disease often appears between ages of 30 to 50. Early recognition, diagnosis, and treatment of psoriatic arthritis can prevent or limit the extensive joint damage that can occur in later stages of the disease.
How long will I need to be on the medication?
Psoriasis treatment mainly depends upon the severity of the disease. It can be treated by topical creams or phototherapy or systemic oral medications depending upon the severity. Regular use of moisturizers is required. Star-based or ketoconazole shampoos are helpful in scalp involvement. Phototherapy is a treatment option which is available in many hospitals. Treatment sessions are 2 to 3 times in a week and may be needed for many weeks. Systemic oral medications such as methotrexate, apremilast are recommended in severe and extensive disease. Newer treatment options like biologics are now available and can be used in cases that are difficult to treat or unresponsive. All medications should be taken under supervision of a dermatologist. Proper follow-up with maintenance treatment is mandatory.
Where psoriasis is most affected?
Psoriasis presents as reddish, well-demarcated, scaly, itchy, raised skin lesions, which are commonly seen on the outer aspects of the upper and lower limbs, palms, soles, and scalp. If psoriasis affects hands and feet, painful fissures or cracks can develop, and these can affect the use of hands and walking. Trauma-prone areas of the bodies like elbows and knees, lower back are commonly affected, and patients may have a single lesion or involvement of the whole body. Occasionally, patient may develop tiny pus-filled lesions. Psoriasis can appear anywhere on the body, even on the eyelids, ears, skin folds, and nails. And there are 5 types of psoriasis. People with psoriasis may also experience other health conditions.